Hello, and welcome to video 1 of the Massachusetts Department of Public Health Antibiotic Stewardship Toolkit for Oral Health Clinicians. Today we are going to discuss antibiotic use, as well as its associated risks and benefits. Let's get started. We'll start video 1 in our two-part video series with some definitions. Next, we'll discuss the uses and benefits of antibiotics, as well as some of the risks associated with antibiotic usage. Specifically, we will outline some of the short and long-term adverse side effects and outcomes of antibiotic usage. Before we proceed, let's define some key terms. First, stewardship is defined as the careful and responsible management of a role or item in one's care. In the field of dentistry, we are entrusted with the job of responsibly prescribing antimicrobials, such as oral antibiotics, to our patients. With that responsibility comes the role of practicing antibiotic stewardship. According to the Association of Professionals in Infection Control and Epidemiology, or APIC, APIC, the definition of antibiotic stewardship is a coordinated program to promote the appropriate use of antimicrobials, including antibiotics, to improve patient outcomes, decrease antimicrobial resistance, and prevent multi-drug resistant infections. More simply, antibiotic stewardship means for a given diagnosis, dentists and their team members select the appropriate medication and prescribe it for the correct duration, dose, and time interval. Since the discovery of penicillin in 1928, antibiotics have saved innumerable lives. Antibiotics provide the ammunition necessary to combat and control bacterial infections. Beyond treating the individual with antibiotic medications, antibiotics benefit the community by preventing population-level spread of infectious bacterial agents. Within the field of dentistry, antibiotics are frequently prescribed for the treatment of odontogenic or tooth-related infections and of oral non-odontogenic infections. Antibiotics are also frequently prescribed as a prophylactic measure. They can be used to prevent a local infection following surgery or to prevent an infection of neighboring tissues and/or organs following an invasive dental procedure. Let's explore some of the frequently prescribed antibiotics in dentistry. This pie chart was taken from the Durkin et al. Paper published in 2017. According to Durkin et al., the antibiotic most frequently prescribed by dentists is amoxicillin, followed in frequency by clindamycin and penicillin VK. Though they are powerful tools for the prevention and treatment of infections, antibiotics are not without risks and adverse outcomes. According to the Centers for Disease Control and Prevention statistics, antibiotics are responsible for 1 out of 5 emergency department visits in the United States. And antibiotics are the most common cause of emergency department visits for adverse drug events in children under the age of 18 years old. Now that we understand that the use of antibiotics can result in an emergency department visit for an adverse outcome, let's think about the adverse outcomes of antibiotic usage within two main categories: short and long-term adverse outcomes. We will start by discussing allergic reactions. Studies estimate that 79% of emergency department visits for antibiotic-related adverse drug events are due to allergic reactions. Allergic reactions to antibiotics range in severity, from a skin rash to multi-system involvement known as anaphylaxis. To act as an antibiotic steward, dental clinicians should collect a thorough medical history from each patient. The next short-term adverse events we will discuss are Stevens-Johnson syndrome, or SJS, and toxic epidermal necrolysis, or TEN. Among the most frequent causes of SJS and TEN are antibiotic prescriptions. SJS typically begins with fever, burning eyes, and a sore throat. Within days, dusky red lesions and flat atypical targets cover less than 10% of the body. When lesions extend to cover more than 30% of the body, this is referred to as TEN. There are many other short-term complications to antibiotic use. Among the most prevalent is gastrointestinal upset. Antibiotics have also been associated with central nervous system or CNS adverse events, which range from mild dizziness to seizures. Antibiotics such as fluoroquinolones have been implicated in organ toxicity. As antibiotic stewards, dentists can combat and prevent short-term adverse events by reviewing each patient's medical history and by keeping up to date on the side effects of the antibiotics that we prescribe. Let's move on to a brief discussion of the long-term impacts of antibiotic prescribing, which include antimicrobial resistance and opportunistic infections. The prevalence of antibiotic-resistant bacterial strains is on the rise. While antibiotic resistance occurs naturally, the inappropriate use of antibiotics is accelerating the spread and the development of antibiotic resistance. Antimicrobial resistant strains of bacteria arise when an antibiotic kills some of the beneficial bacteria in your body, along with the harmful bacteria causing infection or illness. Antibiotics may not kill all of the bacteria. With reduced competition, the drug-resistant bacteria are able to grow and multiply. Patients at the greatest risk for developing antibiotic resistance are those who receive treatment for end-stage renal disease and/or patients on dialysis, patients with solid organ transplants, chemotherapy, complex surgery such as open abdominal surgery, or patients with inflammatory arthritis such as psoriatic or rheumatoid arthritis. Why does this matter? Antibiotic resistance leads to longer hospital stays, higher medical costs, and increased mortality. C. diff is a bacterial infection that causes pseudomembranous colitis. Strains of C. diff can become drug resistant, and these superstrains are increasing in prevalence and severity. Complications from C. diff are costly and range in severity from diarrhea to toxic megacolon, sepsis, colectomy, and even death. In 2015, over 500,000 C. diff infections occurred among patients in the United States. The CDC estimates that roughly 15,000 of these infections resulted in death. In summary, antibiotics have a life-saving effect. They also contribute to short and long-term adverse events, as we talked about in this video. It's important to remember that antibiotic stewardship does not mean that dentists need to stop prescribing antibiotics completely. Rather, the goal of stewardship is for dentists and their team members to select the appropriate medication and to prescribe it for the correct duration, dose, and time interval. Check out our toolkit and the second video in the Massachusetts State Toolkit on antibiotic stewardship for oral health clinicians. Thanks for joining.